Hello and welcome. Again, I have the privilege of talking to one of our Tiny Habits coaches, Dr. Shabnam Kar. She's been a coach with us for quite a while, and man, she does amazing work. I am so excited to have a conversation with Shabnam today and have all of you listen in and learn from here as well. Welcome, Shabnam. So glad you're here.
Thank you, Linda. That was a really nice introduction. So, I am Dr. Shabnam Das Kar. I'm a functional medicine doctor and certified tiny habits coach, of course. And I live in Alberta in Canada. And I think getting certified as a tiny habits coach has been one of the best things I did in my life. And this has been really amazing. And I thought, oh, this should be in every medical course, actually.
I've never heard you say that it was the best thing you've done. I am so glad it's the best thing I've done too. So I'm in agreement with you. So tell me, tell me why it's the best thing and tell me why you think it should be in every medical course.
So, as you know, Linda, there's a lot of conversation nowadays everywhere about lifestyle changes. And we know in medicine, I was trained as an OBGY. Of course, we had no training in lifestyle medicine, but now there are a lot more courses coming up and people talk about a lot of things. When I first changed from, being conventional OBGY to functional medicine, I thought, okay, now I'm not going to use, medicines first and surgery first. It's going to be a lot of lifestyle change. But what I didn't know back then was behavior change is something very different. It's all over the world. A lot of people still think, what Dr. BJ Fogg calls the information action fallacy. It's like,
Oh,
I'm going to give them a ton of information. You should eat healthy and you should eat more protein, don't eat processed food and exercise more. And people are automatically going to do that. As and all of us know, and our listeners know, that doesn't quite happen. Like, eat more protein. So, what does it mean? First of all, does the person know which particular food have protein? So, eating protein is not like just one simple behavior. It has to be broken down to so many things. And that was not education I had in med school. And that was something I learned, in the tiny habits world and behavior design world. So, eating more protein, for example, has to be broken down to so many different things. Some are one time actions, some are tiny habits. And the biggest impact, of course, as we all know, is when we change our environment. So, what BJ calls a super fridge in the book. So,
uh-huh.
if any of you are not familiar with the book, this is the Tiny Habits book, which was written by Dr. BJ Fogg. And the Tiny Habits method, as you probably know, is based on that. And the book has a whole lot more. So, super fridge basically meaning, and I have added super pantry to BJ's concept, having food that you want to eat and it's good for you and you like, you know, just because, fish is very good. It's a good source of protein. And, people know you should eat more fish and less of, pizzas and pasta. What if you are someone who doesn't like fish? So, what should you do then? So, those the troubleshooting things, what you should do, as we say, and in the tiny habits world, we don't have shoulds. It's like, what would have a high impact on the outcome you're looking for, and what do you see yourself doing? So, Linda, that see yourself doing part was really big for me because before this, I never used to ask patients, okay, these are the things that are going to give you the outcome. Let us say they come us telling me about they have anxiety, poor mood, brain fog, and I'm not a psychiatrist. But I know that food has a huge impact on mental health conditions. So I have a very different conversation. I said, okay, these are the things that are going to give you a, better mood. First is food, sleep, movement. So out of all these things, which do you see yourself doing? Rather than earlier, oh, you need to sleep for 8 hours. You need to, I would come up with that long list of shoulds. And very often people felt overwhelmed. So, what has changed in a big way in how I talk to patients, and I hope they're finding it helpful, is now I ask them, what do you think got in your way when you couldn't implement something? That's a very different conversation. Oh, you didn't do this,
That's probably an easier question for them to answer
Yes.
and takes away the guilt that
Yes.
they feel when they aren't doing what they think they should be doing, but for
Yeah.
whatever reason they can't or don't.
Yeah. And
Wow.
the other big area, which is what these are like things that I'm realizing over a period of time, is when I have patients who just meet me for just a few consults, I can tell them a lot of things to do, but unless they have like a, if the tiny habits method is not something they are familiar with, or they haven't implemented it successfully, then many of them, they'll fall off the wagon after 6 months. And very often it happens, I realized, after they travel. I said, okay, while traveling, did you take your supplements with you? No, doctor, I thought I was traveling. There were too many things to carry. And I said, okay, did that habit come back when you finished your traveling? No, it didn't. So those are the things that, I'm like trying to figure out, how can people, number one, get back on track, because most of them know what they are supposed to do. Most people in
Mm,
general know. But the biggest question is, when all of us know that we need to exercise more, we need to sleep better, we need to eat, not have wine and, not smoke and not do this and not do that. Why do most of us struggle with implementing it? And that is where I think the tiny habits method and behavior design come in, because here, like you said, Linda, there's no judgment. It's like, okay, this didn't work. So we go back to that very nice, I love that diagram in the book. I know. Where you go back to troubleshoot. So what made it difficult? So it's instead of that judgment, oh,
mm,
you are an idiot, you're not motivated. Most of the time we call ourselves that. I'm not motivated. I'm just hopeless and
mm.
useless. And, I couldn't do all those things that you asked me to do. Instead of that, it's like, okay, let's see what made it difficult to do. Did you have your supplements with you? No, I didn't have them. How do you expect yourself to remain, consistent with your supplements if you're not even carrying them with you?
Well, and I have to chuckle when you said, "Oh, I'm an idiot. I'm not motivated." It's like, isn't that how we talk to ourselves? We'd never talk to somebody else like that.
I know. I think many of us do, because I'll have patients telling me, oh, whenever, okay, what are you doing? Like, how are you doing? Because with your exercise, you plan to join a gym. How did it work? No, doctor, I know. I feel so bad. I paid for the gym and I'm like, I just can't get myself to go to the gym. So the first thing, of course, I have to tell them that don't blame yourself. It's like it's a problem with the system that you are using to change behavior. Going to a gym 5 days a week and you're working for 8 hours a day, like where in the day are you going to fit that? Yeah, I don't have the time. I said, okay, do you have time to do like 10 minutes of, let's say, do a few dumbbell curls after your first Zoom meeting in the morning? That is
Mhm.
very different from, so that is how I started with. I said, we all know that we need to do more resistance training, build muscles. Muscles are good for health, longevity, brain, you name it. I struggle with, doing moderate to high intensity exercise. And I thought I need to incorporate weight training before I can tell my patients. So I started with, just two dumbbell curls after I switch on my tea kettle in the morning, and as we do in the tiny habits method, and started celebration. And this is the part that a lot of people get wrong who don't understand the tiny habits method. They think that it works because it starts tiny and you just gradually go up and up and up. It's not that. They miss out on that part of the celebration, which gives a positive feeling, which increases motivation. And Linda, I'm sure you've trained so many people. Do you find that people find it difficult to understand that celebration would increase motivation and get them to do harder things? Many people understand it right away.
No, it's that's such a great question. What we have found over the years, and we've taught tiny habits now since 2012, is that
Yeah.
celebration is the most misunderstood part of the
Yeah.
methodology, but in my opinion, it's the most important part.
Yeah.
And it does increase motivation, but what it really does, in addition to that, is it wires in that habit and it changes your identity. It changes your
Yes.
belief in yourself.
Yeah.
And that's huge because that's what really creates more breakthroughs is seeing yourself as somebody who can actually create these changes in your lives. How do you help your clients understand that and implement celebrations?
I tell them, I said, you know what? I can tell you that you need to
Mhm.
celebrate, and you need to, I'll give you a long list from the book has, more than 100 ways to celebrate. But until and unless you experience it, you are not going to understand what I'm explaining. Like it's like
Mm.
explaining the taste of a mango. If you've never eaten a mango, how will you know
Yeah.
what it tastes like? So that is where I feel that, and I was a celebration resistor,
Yeah.
initially.
Me too.
And
Me
I
too.
looked at the list and I thought, I am not one of those, woo-hoo kind of person. Then I thought, okay, I think it was number 6 in the list, which was like, imagine, imaginary fireworks. I said, okay, that is more like me. And then I told myself, I said, see, if, you and BJ, you're talking about celebration being so important, why don't I just trust the process and do it and see
Mhm.
what happens? Rather than, oh, like with the small little thing, it feels silly sometimes. Will this really help?
So what's your favorite celebration?
My favorite celebration is like what I said, imaginary fireworks.
Mhm.
It's like I realize when I've been using a Fitbit for a long time. So
Mhm.
anyone using any of the wearables, you know that when you achieve whatever, let us say my daily step count, when I reach 8,500 steps or something, it comes up with that. And I imagine that, that it's only for me.
I love that. Celebrations are really unique to the
Yeah.
individual. And you're right. What you just said is, play around with it, find something that works. Just
Yeah.
trust the process.
I have learned so much, being in the Tiny Habits community, and we have such a wonderful community. It's so
Oh, don't
supportive.
we?
And everyone is so generous. I mean, you, BJ, everyone is so encouraging. It's like, you learn so much together. So as you know, in this world about longevity medicine, and everyone's like, after this protocol and 100 gazillion tests. And I keep saying, everything will go back to get down to behavior change.
Mm.
Am I helping that person make, because given the existing knowledge, we know quite a lot about what people can do to improve their health. People themselves know. But
Yeah.
how can I help them break it down into things that they can implement rather than, do another 100 tests and get overwhelmed with all that information? So
Well, and you mentioned our community and Shabdam. I've got to give you some credit. You bring a great depth of knowledge and experience to our community, and that's what makes our community so amazing. It's
thank
not
you.
just about BJ and me, it's about all of you that are part of it and what you bring to the community and what you share and your strength and your knowledge. That's what makes it such a great community. So thank you for being part of that, and thank you.
Thank you for creating this, making it easy for people to talk about stuff. And this is such a safe environment. And every day, every time, I learn so much from all the coaches, because each person has a different way of looking at a particular problem, which probably I would never have thought of.
You've taught a lot of brain health habits. I know that's one of your areas of expertise. But I've learned from you, I'm going to take that one more step, how you've designed tiny habit recipes to help your patients implement brain health habits. Talk a little bit more about that process and what you've learned through working with those kinds of individuals.
So I use a framework because, as you know, I mean, you work with Dr. Amen, so there's so many things that impact brain health, and it can get very overwhelming for people. Where do I start? So I have sort of like a framework which I call the 8 keys to long-term brain health. And some of the components, of course, everyone uses: sleep, food, movement, building stress resilience. But a few things that I add: one is appropriate prescription medications and therapeutic supplementation. And another two big areas which I'm not an expert in is: one is meaningful social connectivity,
Mm.
relationships, and mindset. So is it, again, mindset? I need to clarify because people get confused between. So what I call it is health optimism, and health optimism is a concept I'm trying to fine tune. It's basically this idea that regardless of what illness I have, because a lot of, I mean, nowadays most people have maybe diabetes, hypertension, they're dealing with a heart disease, abnormal cholesterol levels, they have disabilities, joint pain, arthritis, multiple conditions. So, health optimism is basically this belief that regardless of how serious and how many illnesses and how many complex conditions someone has, there is still a lot of things that we can do in terms of behavior change, which I won't say it's going to cure some serious condition, but it's going to improve the quality of life. So when it comes to brain health, we talk a lot about, dementia is potentially preventable. And actually on our podcast, the Brain Podcast, Andrea and I talk a lot about, the tiny habits method and one-time actions. And we've been told that, our podcast gives a lot of practical stuff to do. So fourth, again, if I put it into that framework, which is the area now, obviously as a physician, I want them to get their medications right if they are not taking their medications, and get all, but then now I start with the conversation of where do you want to start. Is it sleep that you find easiest to deal with? Is this something you've been thinking of doing and you just need probably a few ideas? So then for each of those conditions, I have a whole bunch of, I call them strategies. Then I try to break them down to a tiny habit. So let's say I'm looking at a tiny habit for taking, for example, prescription medication. Now I'm very interested in better management of hypertension because worldwide hypertension is not well managed. And a lot of people do need prescription medications. Some of them struggle with it because they forget. So, what I would suggest is, let us say I have recommended someone take a blood pressure medication at night. So, tiny habit recipe would be after I put my toothbrush back into the holder at night, I will take my blood pressure medication and then celebrate whichever way. So the most important thing here is the medication in the bathroom next to your toothbrush? If the medication is in the kitchen, then this habit is not going to work.
I didn't before Tiny Habits until I really understood
No.
that your environment impacts your behaviors and your habits, and to set your environment up for success. A simple thing like one-time behavior, putting your medication
Yeah.
where you're going to take it.
When I put my dumbbells on the dining table, and my husband likes the house very neat. I'm not as much of a neat freak. He said, "What are these dumbbells doing on the dining table?" I said, "This is related to my tiny habits method in the morning when I switch on my tea kettle. So if my dumbbells are in the basement or they are in a box somewhere hidden, I'm not going to do that. I
Well,
know. I know for sure in the morning when I'm in a hurry, I'm not going to go down to the basement looking for my dumbbells." But only having the dumbbells on the table is not going to create that habit either.
you'll probably just walk by them.
Yeah, because I have done that before, before tiny habits. So I know that is not going to work. And then they make you feel guilty because you're not using them.
Let's talk about guilt for a minute. As you know, Shabnam, I'm very religious. And oftentimes in religion, guilt is used as a whipping stick,
Yeah.
unfortunately. I do think maybe sometimes in life, guilt is beneficial, but I don't think very often.
No.
I'm interested in seeing what your experiences are. In my work, when I work with clients and they feel guilty, it's actually harmful. It actually
Yeah.
stops them from trying to progress. It actually makes
Yeah.
them feel like they cannot succeed. What do you see in your practice?
So this is very important. And I'm not religious. I mean, religion doesn't have anything to do with it. Sometimes it's just people feel guilty because of so many things. It's like how they grew up and how guilt was talked about at home and all those things. But one big thing, and this is what studies have shown, because patients who feel guilty and don't come back, I won't know what has happened. So studies have shown that when doctors tell a patient, you need to lose weight, I mean, everybody knows that number one, losing weight, people can lose weight on any diet, a cabbage soup diet or a low calorie diet, or not eating, juice only, medications, different ways. But the biggest challenge is in maintaining the weight loss. That's a different conversation. So what happens is, now doctors tell patients, and this is like a 10-15 minute conversation with the primary care provider. I'm not saying doctors don't want to explore in details, but they don't have the time to explain. Okay, you need to lose weight. And then the patient goes home and is struggling because they have gone through numerous cycles of losing weight, gaining it back. And then what happens? This is the unfortunate thing. And I needed to read papers to know, because patients obviously won't come back and tell me because they're not coming back. A lot of these people, and particularly women, don't go back to the doctor and say that, okay, I'm struggling and weight loss was not one of my goals. I went to you for something else and you are talking to me about weight loss as if I don't know I need to lose weight. So they don't go back to the doctor. And what ends up happening is there are other conditions which can be treated. Maybe their blood pressure is not at target and the doctor needs to increase their medication. But that is missed out because the patient's feeling guilty. The doctor asked
Mhm.
me to lose weight and I couldn't lose weight in the past. And I'm like, right now, my life is not such where I can get onto a program and do all these things. So I'll just not go back to the doctor. you know so what happens is not only is the patient feeling, and that's again guilt. And as you said, again, I don't have a huge experience in this. I don't think guilt works really. Like, I know for
No,
sure it doesn't work for me personally, and I'm sure it's people feel much more like the problem solving method works much better than tons and tons of guilt.
I completely agree. And I think helping your patients see where they're succeeding
Yeah.
is more powerful than focusing on where they're failing. Yeah, we learn a lot from
Yeah.
failure, but it doesn't make us feel good.
Yeah,
So,
and
mm,
nowadays that's what the other big change I have, and this is something I deliberately do,
mm,
because when patients come to me, okay, they come with lab numbers, and so first I try to focus on, okay, look at this. See, this is where you were. This is what your number is today. This is really good. You need to, and congratulate yourself. This is blah blah blah. Then we come to the troublesome ones. Whereas I am sure in my earlier life I used to probably focus on the problem first,
yeah,
because again, I had a limited time. I have to solve so many things in this short
uh,
time to talk about their blood pressure, talk about their blood glucose levels, or talk about inflammation. When am I going to congratulate them on the things that are
uh,
trending in the right direction?
maybe Tiny Habits has helped you focus on what's working
Yeah,
right and going well and focusing on that. That's helped me. It's changed how I parent. I had to be a disciplinarian, had to keep some kind of
yeah,
semblance of routine, and my kids had to be a part of that. And as I learned Tiny Habits and started implementing Tiny Habits, and like you mentioned, learn from BJ that people do best by feeling good, not by feeling
yeah.
bad. I changed my parenting approach to really focusing on helping my children see what they're doing right. And as a result, I don't have to focus on what they're not doing right because they correct it themselves. Maybe you're seeing something similar to that with your patients.
Yeah, and I think, Linda, what you pointed out is so important, because sometimes we kind of work from, like, an automated way of working. We don't think what we are doing. And again, something that BJ said in one of our sessions was, remember that everyone is doing the best they can.
Well,
The best they can may not be the best for them, but having that, okay, this, my kid or my patient or whoever it is not trying to do that something wrong because they don't want to do it. Like, if they don't want to do it, then let's focus on something else, which is what I learned from the Tiny Habits method. That if you're struggling with creating a habit and you've tried all the troubleshooting methods and everything, maybe that's not a habit that's right for you right now. Let's
yes.
shift to something else that is, maybe it's not even related to health. And you have worked in weight loss, and how, I think you were talking about this, that, let's not focus on weight loss first. Let us focus on, maybe you want a, more organized table. I don't know. But most people would not connect the table with weight loss.
You're right. I've worked a lot with women in weight loss. I've done some research and studies in that respect. And it's just like what you said. They know they need to lose weight,
Yeah.
but they feel like a failure because they haven't been able to implement those behaviors because they don't know the right method. It's not
No.
their fault.
Yeah.
But once we focus on creating habits around something that doesn't have that emotional baggage and
Yeah.
they start seeing that success in the application of the Tiny Habits method, they gain confidence,
Yep.
which in turn helps them realize that they can then accomplish what they want to accomplish with their weight because they now have the skills and they now have the belief in themselves. That's huge.
Yeah. That is so, this, this change in identity that you pointed out earlier,
Mm,
Linda, I think it's one of the biggest things, because that gives a kind of confidence which, no amount of, nudging and pushing and having notification on the app and emailing them and
well,
messaging them. I've tried a lot of those things for my patients. None of them work.
so what has worked? What has worked with your
What
patients?
has worked, like I said, one is the troubleshooting method, and two, most importantly, when someone falls off the wagon, this is what I would love to have for all my patients. But unless they are on a long term program with me, it's difficult to implement. It's like, okay, can you catch yourself like that these last few days you've been, having New Year parties every day, and what are the things you could have done differently? So one is, where do the challenges come from? So again, the problem solving method. Where do you think was the biggest challenge? Okay, I ended up eating food that I don't normally eat at this party because they didn't have anything that I eat. I said, okay, then the solution is you need to eat something at home that is satiating enough so that you don't end up at the party hungry. Because when you're hungry, your
Yeah.
brain's CEO, the impulse control part of your brain, is not going to function as well. And this is again nothing to do with you as a human being. It's just the way our brains work. You
Yeah.
haven't slept well and you go to the party hungry, then don't expect yourself to reach out for, the most nutritious food. Maybe it's not even there. So why don't you eat at home, have some high protein, maybe some eggs or some avocado or whatever favorite protein or fat you have, and don't reach the party hungry,
Hmm.
instead of saying, "Oh, you shouldn't go to parties," which is a ridiculous advice.
Yeah. It's not going to
Yeah,
work.
it doesn't work. So instead of that, so where did the trouble come from? Then I have patients who will, so again, like I said, it's the troubleshooting method. I'm still struggling with, this particular thing. I said, okay, what is it again in the tiny habits world? What is it making it difficult? I don't have it set up correctly. I said, okay, here's a one time action for you. This is something you can set up properly so that it's easy for you to do and not make it more difficult for you to do, like having the dumbbells in the basement when you want to, do two dumbbell curls in the morning. Sometimes I find like, these are small things, which maybe because we feel these are small things, but for many people, it's like, oh my God, I never thought of that.
Yeah. Well, and that's where a professional, a doctor, and a trained expert in tiny habits can come in and help you see the world differently or design your life to achieve what you want to achieve. I love that. I've got a couple more questions for you. One of them, and this is one of my own frustrations and I want to get your opinion on this. Um, Little backstory. One of my younger sisters, um, was recently released from the hospital with a diagnosis of rheumatoid arthritis. She
Okay.
was in extreme pain and
Oh,
had been for quite some time. And as I picked her up from the hospital and brought her back home, and I was going over her paperwork with her, on her checkout work, it said diet, no restrictions. I
not
I
true.
lost I lost it.
Yeah.
I lost it. The other brother that's a doctor, and I said, "Why don't they give her some guidance and some help on getting on an
Yeah.
anti-inflammatory diet?" And he said, Doctor's in a hurry," and he just checks the box. It's like, yeah, but it's somebody's life, it's somebody's health. Why
Yes.
don't they at least refer her to either a dietitian or refer her to an anti-inflammatory diet? There's a lot of problems with modern medicine and the way that we as patients get help. There's a lot of wonderful ways,
Yes.
but you as a doctor, um, number one, why did you get certified in Tiny Habits? And number two, how do we overcome some of these shortcomings in modern medicine? And I love functional medicine, so I'm so glad that's the path that you went into after being
Yeah.
an OBGYN. I think it really does bring the whole person into view instead of just the one problem that somebody might be having. Elaborate. I mean, talk to me a little bit about this because this still is a frustration. Fortunately, uh, my sister Kim is living here with my mom and I now in Utah, so I'm taking care of two people right now, actually.
Oh, okay.
And I have been able to help her get on a better eating plan that has helped her immensely. But she didn't, number one, even know that's what she should be doing. And number two, didn't know how. And you talked a little bit about that's one of the missing pieces in medicine is the
Yeah.
how. Let's talk a little bit about this.
So one of the things that you brought up, something nutrition, as now things are changing, but it is still not changing at the pace at it that it, because now we have access to a lot of information, and sometimes for people, for someone like your sister, it's difficult to assess that is this the right information for me. And we always say check the credentials of the person. Now, credentialed person, a doctor who's a rheumatologist, most
Mhm.
people would expect a rheumatologist to know what is right about food. But the biggest problem is we are not taught about food in med school yet. So
No.
how I talk about this is, as a functional medicine doctor, food is one of the first things we look at. So I said, okay, I'm a doctor, I'm a functional medicine doctor. I was trained as an OBGY. But I am now, if you ask me what is the best approach to a brain tumor, should it be an open surgery or a, endoscopic surgery? I won't know. I'm not a neurosurgeon. So, just like that, a rheumatologist may be exceptionally well trained in rheumatology, but food was not a part of his education. So it's not easy again because, Linda, as you know, there's a lot of misinformation. So people will read something or they watch something who sounds very convincing. They speak well and, all that. And they'll say, oh, you must do this. And this is the thing. That is not always true. So discerning information, which is the right information. And particularly for rheumatoid arthritis, there are a lot of clinical trials which have gone into looking at food, so giving up gluten containing food and anti-inflammatory, in the sense each person is different, and I can talk until kingdom come. But yeah, it's like rheumatoid arthritis, people who have changed their food, they have felt a whole lot better. And sometimes I'll have doctors telling me, where is the data? I said, where did you look for it? There's enough data in some of your own journals. It's not in some obscure journal of something or the other. It's in some of your rheumatoid. So yeah, just because they are very good at again, I would not go to, let us say, like I talked about the neurosurgery, example. A rheumatologist is not trained in food for, rheumatoid arthritis unless they have taken the pains and done, self-study and all that thing. But here, Linda, the challenge is, how will your sister know whether the doctor is trained or not trained?
It was just baffling to me when dietary restrictions that said none. It's like, no, Kim, you need to get on a gluten-free diet. You need to get on an anti-inflammatory diet. You need to stop drinking soda. Let's start working on some better habits for you. This also leads to the question, because Shabnam, you're a very skilled doctor. You're very well trained, and you came on Tiny Habits. Why? How'd you find it, and what led you to get certified?
Sometimes I try to think back what was sort of the first thing that happened. I think the first thing that happened was I read the Tiny Habits book because I love reading. So it must have come into my, attention somewhere. And then I thought, okay, this is a very different way. And then I signed up for the free course. This was so many years ago. And after I did the free course and finished struggling with the, celebration and completed it, and then I realized this is a much better way to teach my patients about behavior change than all my previous methods of giving them a lot of information and then they get completely overwhelmed, and not breaking it down into simpler steps and creating habits from those.
I admire you and respect you for taking the time to
Thank you.
seek out a better way and to learn it and then, of course, implement it and teach it to your patients. You'd mentioned that you have habits for brain health. How would our listeners get access to some of those habits that you've designed?
My website has a list of the tiny habits for brain health. Again, going back to the same thing, where does someone want to start? So we have a list of, I think we have about 10 tiny habit recipes for brain health. And if someone were to ask me what is the biggest impact on brain health, I would say exercise, moderate to
Oh,
high intensity exercise. But is that something someone should start as the first thing? No, not if they don't see themselves doing it and they have, multiple disabilities and challenges like that. So start with, again, the usual tiny habits recommendation. Start with any one small area. And then they can, go to all the other different areas, whichever they feel comfortable with.
huh.
It doesn't have to be in a stepwise. To this week you focus on sleep, and this my protocol says sleep comes first and food comes later. No, my protocol doesn't come like that. Mine is a framework. These are the areas you need to look at, and start with where you can and start with where you feel comfortable with. So, food, eating higher quality protein, because that is going to keep blood glucose levels stable, and high blood glucose, or even for those who don't have diabetes, that's one of the biggest risk factors for hyper,
Mm.
dementia. I look at three things. The second is normal blood pressure levels. Again, talk to your doctor. None of this is medical advice. First of all, do you know your blood pressure levels? So that's a one
Mm.
time act. Measure your blood pressure. Do you have a device at home? So, normal blood pressure, normal blood glucose, low levels of chronic inflammation. and inflammation levels can be measured. And food is one of the biggest sources of inflammation for most people. These three
Oh,
things would be primary. Then, of course, for each of these, like blood glucose can be managed by food, sleep, medication, exercise. So, different strategies can be used for one outcome, which is the strategy that someone wants to start with.
great. Um, my brain is going a mile a minute, and I know we've got a time limit here, so we're just going to have you back. That is just as simple as that. But
Oh, I'd love to be back.
if somebody wants to work with you, Shabnam, are you taking new patients, and is that possible even if they aren't in the same location as you are?
It's absolutely possible because I work mostly online. So my clinic email address is info at drkarmd, drkarmd.com. Just they can just send an email, and depending on what they want to talk about, and we can set up an appointment and take care.
I'm so grateful to have you part of our Tiny Habits community. Thank you for sharing your wisdom and your insight with us today.
Thank you, Linda. It's been a great pleasure.